It was about 7 months after being treated in July of 2019. I woke up one morning, my room seemed extra bright, the house was quiet. So I sat up on the side of my bed and I didn't feel anything. I thought I was dead. I started to pinch my face and I was like, okay, I can feel that. But nah. So I called my kids in the room. They rush in. They can see me. I can see them. So I hug them and I send them out. And when I send them out, that's when it hit me that I was better, that it worked. And I was like, this is what normal feels like. The first time in over, I know, 25 years that I woke up and I didn't have to remind myself to take a deep breath. The usual pain that I had in my lower back and hips that was every day, it was gone. And life has been like that every day since that morning in 2020. I didn't feel anything. So I was like, God, thank you.
This is Genetics for Healthcare, a podcast for patients.
This is Genetics for Healthcare, podcast for patients and their caregivers with the mission to empower them to advocate for a precision medicine approach to disease screening, treatment, survivorship, and prevention. It is really an honor to share patient stories here on the podcast to hopefully encourage and empower you to become a better partner and a more informed partner to make shared treatment decisions with your doctors and other healthcare providers. And today we have got Victoria Gray, sickle cell warrior, the first patient ever treated with CRISPR gene editing for sickle cell, which was designed to eliminate the pain and the suffering associated with the disease. And she was gracious enough to come on and share her story to empower you. Victoria, thank you for being a guest on Genetics for Healthcare.
Thank you for having me, Ron.
So I want to talk about and kind of talk about your experience with sickle cell. You are inspiring people the world over. Just a little statistics about sickle cell, and I'll ask you. There's 1 million people affected globally, over 1 million people affected with sickle cell disease globally, over 100,000 in the United States, and 90% of those patients are Black. Victoria, tell us about like what your childhood experience were, what you understood that to be when you were diagnosed. How did that all come about in your life?
Well, I was diagnosed at 3 months old. Um,
Mm,
yes, mom took me to the hospital, thinking that my pain was coming from my dislocated shoulders after birth. But when she went there, that's when she found out that I had sickle cell disease. I was in my first crisis, and the doctors also told her I wouldn't live to see past 7 years old. So she received a crushing blow. And my childhood just pretty much resembled that night. I have a few days of feeling what was then normal to me, going to school, playing. But I remember some days I'm excited to leave school. This is Head Start, pre-K, what people call it now. So that would put me at the age of 4, ready to go outside, meet my best friend, and play. Um, as a requirement by grandma, I had to change clothes. But while I'm doing that, I get this lightning type pain shoot down one of my arms. And then it goes across my chest, down my other arm, and then my entire body was completely covered in pain. I fell to the floor. I was crying. And my grandma, she rushed getting the Tylenol threes and the hot towels, what
mm.
doctors said would work, what to do when I was in crisis. But that still didn't work. She was praying, but I had to go to the hospital and stayed there over a week getting morphine, and I received a blood transfusion, IV fluids, but that entire week was filled with pain.
Can you just kind of describe like what that is for people who may not know or be familiar with the disease itself?
Vaso-occlusive events.
Yes.
Okay, it's when those cells begin to sickle and become sticky and they block off blood flow and
Okay.
also they can't carry oxygen to the muscles and organs that need it. So the result of that is extreme pain, a pain that can't be put on that 1 to 10 scale that you see at the hospital.
Hmm.
It's on a scale of 100. Is a pain so severe that I thought my heart would stop from it. It was like getting hit by a truck, struck by lightning at the same time. Everything hurts. It's hard to breathe, and no amount of rubbing, icy hot, and a lot of times, morphine and Dilaudid won't stop that level of pain.
The doctor said, 7 years old. Obviously, you beat those odds. And from what you described, like you were otherwise a normal kid, like you had the same goals and aspirations and dreams that other kids. How did this like hamper your experiences growing up as a child and in your teen years?
It limited my childhood. I couldn't stay outside and play for long periods of time. I had to take breaks because the heat and exhaustion could send me into crisis. My dreams of wanting to be on the cheerleading team in
Mm,
elementary, my doctor said I couldn't do that. Going into high school, wanted to be on the basketball team because of my height, and I just wanted to explore. My family loves sports, but that's another thing I couldn't do. Going on to graduate in high school, signed up for the United States Navy, getting ready to leave, and then I get that call. I don't qualify because I have sickle cell disease. Um, Wanted to join college to become a doctor, but the curriculum and the amount of time it would take and the stress from studying and clinicals. So I was warned not to do that. So I tried nursing. But while I was pursuing nursing, that's when I had one of the worst crises of my life. And it took away my ability to walk, use my arms. I couldn't even wash my face or feed myself. And I had to go through rehabilitation for 3 months to regain the use of my legs. After that, I gave up on my nursing dream,
mhm.
and I just tried to be a good mom and a good wife after that. I was in my early 20s, and I figured that was all I could be. But then again, sickle cell hindered me in that area because I constantly was taken away from my husband and kids, getting shipped off in the middle of the night, waking up in crisis, and spending what began as 1 week as a child to 2 weeks to a month in the hospital at a time away from my family. So all of my dreams had been crushed.
What is amazing to me is that you obviously had a drive and a zest for life, even despite dealing with sickle cell. And I've heard you talk a lot about your faith. You know,
Yes,
you did, even though you suffered from this the symptoms of the disease for years, you still went through wanting to be a cheerleader, wanting to play basketball, wanting to go to the Navy. Like, where does that drive internally come from? And why didn't, it sounds like a silly question, but why didn't, the pain and what you went through as a child crush that ability to kind of dream and think about what you wanted to do?
because I'm a woman of faith. My grandmother brought me up in the Church of God in Christ. So I believe that with God, all things was possible. All
Come
I
on
had
now.
to do was ask. So I held on to that. And as we say, he may not come when you want him, but he's on time. So I held on to that one day. I didn't know when, how, that I would be able to accomplish my dreams. It was times where I got tired um, because the pain was ravishing my body, and then you add on medications that make you extra tired. And I question, I'm like, God, I know you put me here for a reason. What is it? I know it's not just to suffer. And hearing people around me, like my Sunday school teacher, she said, Vicky, it's not just for you. What you're going through is going to
Mhm.
help somebody else.
Okay, Victoria, we can pause there for a whole praise break because I am a believer that what we experience in life, has to happen to move us to a place of purpose. Um, and hearing you talk about your faith is critical here, because it is reported, even though you were diagnosed at 3 months and the doctor said you wouldn't maybe live beyond 7, um, today, the majority of patients, and these are just statistics now, we got to be careful with statistics. The majority of patients with sickle cell disease or beta thalassemia um, don't live beyond their 40s. But it's important to note that those are just estimates. Individual life expectancies are obviously going to vary. With proper management and care, many people with sickle cell disease can live like long and fulfilling lives, just like you did. But talk about, as you got older, you talked about you had a dream to be a doctor. Then you had okay, I can still help people with being a nurse. But talk about, as you started to get older and your pain crisis started to increase, in what brought you to the point of um, being in a clinical trial, or even having that conversation.
Yes, as I got older, my pain was more severe. As a child, I would be sick that week, and then two days at home, I would recover back to what was normal for me. But as an adult, those crises were so severe. After staying in the hospital 2 weeks to a month, I still could never reach back to normal again. There was always some level of pain. I was weak, and what was harder, honestly, is the care changed also.
Mm,
Um, Being in pediatric care, you don't have long waits in the ER. They get you right to the back. They believe you right away. They know you have sickle cell disease, so they fly into action. They
mm,
give you the blood transfusions immediately, pain medicines immediately. But that changed when I moved to adult care. So it changed to sometimes waiting 12 hours in the ER waiting room, not being called to the back, but 12 hours in the waiting room just to see a white lady come in with pink eye and get called before you, and you're barely breathing. And when I get called to the back, I still have another 45 minutes to an hour trying to explain what's going on with me, when hearing sickle cell should be enough. So that started to kill my will a
mm.
little bit. But I still had some fight left in me. Being a woman of faith, so much happened to me, and I became tired. Being in situations where a nurse chose to give me the wrong medication. I was in the hospital. I had been in there for a couple of days, so I thought I was improving. I felt like I was. But when she took shift, I called for pain medicine on the schedule, because that's what was keeping my pain under control. And we had a nice conversation. I said, "Oh, I feel like I'm getting better. I think I'll be able to go home soon, um, and be with my kids." And she's giving me the medication. She's talking to me because I'm familiar with her, and I'm sitting up on the chair because I was tired of being in the bed all the time. But when she gives me the medicine, I get super dizzy. That was unusual. So she has to help me back into the bed, and I fall asleep for about 4 or 5 hours. And I wake up, my pain is extreme. It's worse. I don't know what's going on. I call her back for pain medicine. She rushes in with pain medicine, and I'm having a conversation like I usually do. I said, "I don't know what's going on. I thought I was getting better, but my pain is worse." And she said, "Well, actually, it's been about 10 hours since you had something for pain." I said, "No, it hadn't been 10 hours because I called you. You gave me something about 5 hours ago." She's like, "No, I chose to give you a big dose of phenergan because I wanted to see what that was going to do."
Wait. Hold on. Let me replay this. So the nurse in charge of your care, who you were interacting with, when you called for a dose of pain medication, did not give you pain medication. What did she give you?
She gave
Finnegan.
me Finnegan. Finnegan is what they usually give us for nausea. It helps me with my nausea. But she doubled, if not tripled the dose. It has a sedating power. It can be used as a sedative actually. And she knocked me out because she didn't feel my pain was real.
Uh,
And now
so
that I wake up and I'm saying, "Oh, I'm in more pain," I guess now she believes me. And like and admits that she didn't give me pain medicine earlier.
so it's not just the fact of battling with the disease. And you said something I'm gonna just recall real quick. It's not just battling with the pain associated with the disease, it's battling people's belief and perceptions
Yes.
of you as a sickle cell patient.
You're battling the stigma that comes along with sickle cell disease, that comes along with being an African American woman. So you're fighting the disease, and when you become an adult, you have to fight your the healthcare staff that don't believe you, because there's no way anybody can be in that amount of pain and still look put together.
So this is something that is being called out more in the healthcare system is racism in healthcare. Okay, for those who may not know it exists or believe it exists, it is well documented. But specifically, when we're talking about sickle cell disease, there was a an article in the New England Journal of Medicine published in 2020. And I'm just paraphrasing here. Discrimination is an issue encountered by many sickle cell disease patients across the globe during their lifetime. In a perspective piece published in 2020 by Power, Hayes, and McMahon, they expressed that there may be no population of patients whose healthcare and outcomes are more affected by racism than those with sickle cell disease.
Yes, it's sad.
Let me take y'all back a little bit more. So, in doing this, and I've heard Victoria, you talk about very courageously, by the way, how you were treated and describing the racist mindset that people look at that treated you with and other sickle cell patients may experience in silence. In the 70s, many African American people were deprived of jobs, educational opportunities, marriage licenses, and insurance if they carried the sickle cell trait. In terms of sickle cell screening, sickle cell had to meet prevalence thresholds not demanded of other rarer conditions before newborn screening to save the lives of Black infants was eventually made universal in England in 2004. And in this same paper published in New England Journal, they conducted a study examining the motivations and decision-making processes of enrollees and decliners of high-risk trials for sickle cell disease. And of the 26 sickle cell patients interviewed, the majority reported negative interactions with healthcare providers. These experiences were so bad that many chose to avoid going to the hospital even when they were having pain crisis events.
I've been
You
there.
know, something else that is not talked about also, as you mentioned, dealing with the pain, dealing with the perception of those and how they treat you directly, making decisions on their own to not give you pain. That's so foul. I don't even know what to say about that. Um, but the disease affects not only you, but it affects like family, right?
Yes.
Talk about how it affected your relationships, like with maybe your children, your level of activity, and the things that in your family that you would want to do.
With my kids, a lot of times they would want to go to the park or go swimming, but I would be sick or real weak and couldn't do it. And it hurt for me to have to limit their childhood because I was limited. So it was an emotional blow for me. And even being a wife, my husband is in the military, when they would be deployed and all the other wives would fly to be there with with their husbands, I couldn't go. I couldn't even fly.
So you
But
can't fly? You couldn't
no,
fly?
my doctor told me that it would be too risky for me to
Mm.
fly because the atmospheric pressure and the altitude could trigger a crisis and splenic infarctions, all kind of problems for me. So I didn't even try. Um, but most of all, what hurt the most, and it was my wake up call. I had began to be tired. I was sick a lot. Going into the hospital seemed like I was home maybe 2, 3 weeks at the most, and back in the hospital. My oldest son behavior. He started to get in trouble a lot at school, just small stuff, disrupting class, shooting paper basketballs, um, being mean to other students, like just doing petty stuff. And my twins, my girl and boy, they was helpers at the time. They would like to help the teacher out in the classroom, and they kind of stopped doing that and retreated inward, so their teachers would know when I was in the hospital. So they would call or text like, "You're in the hospital." I was like, "Yeah, how did you know?" And your kids are acting different. But this one particular day, my son's teacher called and she said, "Victoria, I need you to come to the school." And so I came and she sat me down and she said, "I'm just going to be honest with you." She said, "Jamarius is acting out because he's afraid you're going to die. He
Mm.
don't want to be at school and come home and you're not there." And that hurt me, because at that time I wanted to die. I felt like my kids would be all right, but hearing and seeing how my life was already causing them those traumas and deep hurt, I couldn't imagine what my death would do to them. So that energized me to look for treatments. And that's when I began looking. One day I saw this article. My family sent it to me on Facebook. A young lady from Chicago underwent a haplo transplant. And I think her mom was her donor and she was better. It was an article about her. So that energized me. But sickle cell hit me again. I'm in crisis. This time in the hospital with ketamine in one arm, Dilaudid PCA in the other, and I was still in the worst pain of my life. I had chest pains, leg pains. I couldn't get up. I couldn't move. And that's when I called the head hematologist in. I called the hospitalist, the nurses that was treating me. And I asked, I said, "Do you guys know of any treatments that can help me? Because I can't keep living like this anymore. I'm suffering." I asked them about the article. Have y'all heard about the haplo transplant? And they all just stood there, they quiet. They looked at one another, then they looked back at me and they said no. They didn't have any options for me.
Mm.
So I was in the hospital probably another week in that position. But when I went home, I remembered my roots. And that's what grandma taught me, that God had the last say. So I pleaded with God for my life, not for myself, but for my children. I said, "Lord, I asked you for kids and you gave them to me. So can you please allow me to grow them, be here to watch them grow up to where they don't have to be as dependent on me anymore and they can stand on their own, and I won't ask you for anything else." And after a month, less than 30 days, I got a call from my hematologist. Said a hematologist from Nashville, Tennessee, Dr. Frangul, had reached out and asked her if she had any patients that was interested in that haplo transplant. And she thought about me because she knew I was losing hope. So that's when I traveled to Tennessee to meet Dr. Frangul to see if I qualified for a bone marrow transplant.
And so, what was the conversation like with Dr. Frangul and King? And how was Dr. Frangul in terms of, um, his care and, we talk about a lot of doctors and how they, perceive But what was different about Dr. Frangul and how that led to your clinical trial?
Dr. Frangul has a light, joyful spirit. From the time he walked in the room, I could see like the light in his face. He was happy to see me. And when he asked me what I had been dealing with sickle cell, and I told him, he listened. The conversation wasn't rushed, and I could see the emotion in his face. He placed one hand on my knee and he said, "I wish I would have met you 10 years ago. I could have
Mm,
helped you." And I could tell it was genuine. He cared about what I was going through. And so I was trusting him to see me through the bone marrow transplant. But we started the testing. There was a lot of tests. I had to test my lungs, my heart, sample of bone marrow, do tests on my brother. So we was going through all that test. He explained the chance of graft versus host disease.
mm,
That's if my body rejected my brother's cells. And I was fearful of that because I really didn't want to trade the devil I knew, which was sickle cell, for graft versus host on top of that. It was scary, but I prayed about it. While I was there, undergoing testing, I went into crisis. He moved immediately when I said I was hurting, and he can see it on my face. He, I didn't have to explain my pain regimen. He went in, didn't question what I normally took for pain. He gave it to me. I didn't have to overly explain anything. And while I was there, um, that's when he approached me by my bedside and said that the CRISPR trials was opening up. He asked me, have I ever heard of it? And I hadn't. And that's when he began to explain that it would be like going into a book with thousands and thousands of words, finding a word that was misspelled, correcting that word without altering the story.
mm,
And he's that's what his theory was, that CRISPR would go in, turn back on the switch that creates fetal hemoglobin without messing anything else up in my DNA. So it would be a precise edit. And he didn't make any promises, but he said in hopes it would decrease my crisis at least by 50%. And I gave him a yes.
wow. So, how revolutionary is everything that you just explained, right? So obviously you're an expert on the disease and the CRISPR at this point, certainly. But when you said it goes in and edits fetal hemoglobin, um, that's fetal hemoglobin is um, the dominant, hemoglobin cells present in the fetus. Like when a baby is being, created in the womb, those genetic um, signatures kind of take over to set the course of our life. And it was as if, you know, genetically you were taken back there and corrected your DNA so you don't or no longer suffer from the effects of the sickle cell disease?
Yes. It would turn on the switch, which is BC11A,
Mm,
to signal my body to start making fetal hemoglobin again. And it would be like living with sickle cell trait instead of sickle cell disease. So I would have half hemoglobin F and half hemoglobin S. And with that, that's why he said 50% decrease, at least 50. But when God shows up, he shows out. It took away completely. Since 2019, I haven't had a sickle cell crisis, a blood transfusion, and by the summer of 2020, I was able to take off my fentanyl patch for forever, get rid of my Dilaudid pills and my hydrocodone, so I am no longer on pain medications.
so after the therapy, and so is it a one time, treatment? Like what is the care like?
It's a one and done. But the procedure itself is it's tough. You have to go through collection phases, getting on a machine that I was very familiar with, because it was the same type of machine that would pull my blood out every month and replace it with donor blood. But this time it would pull my blood out, remove the stem cells, and give me my blood back. And I had about 2 cycles of that. And the cycles are 3 days straight on this machine for 6 hours at a time. Go home for a month, then go back into the hospital for another 3 days and do it all over again to see if they have enough cells. But some patients have to do that more than 2 times to get enough viable stem cells to be edited. And then once they're edited and ready, you have to go into the hospital, receive 4 days of chemotherapy. And I had about two 2 to 4 days of rest. And then just the push of 4 valves is what was amazing to me. When Dr. Frankel pushed those cells back into me, and I'm like, that's it. And he said, that's it, girl. I'm like, wow, I shed tears that day. Even though nothing had changed yet, I knew that those valves contain my super cells, my miracle, the promise that God made me. And I just cried tears of joy that time that I had overcome the disease.
So after the treatment, it just seems like such night and day. But tell us about when you knew that you were healed and cured.
When I knew the morning I woke up, it was about 7 months after being treated in July of 2019. I woke up one morning, my room seemed extra bright, the house was quiet. So I sat up on the side of my bed and I didn't feel anything. I thought I was dead. I started to pinch my face, pinch my thighs, and I was like, okay, I can feel that. But nah, I must be like Casper the ghost because I don't want to leave my kids. So I call my kids in the room. They rush in. They can see me. I can see them. So I hug them and I send them out. Um, and when I send them out, that's when it hit me that I was better, that it worked. And I was like, this is what normal feels like. The first time in over, I know, 25 years that I woke up and I didn't have to remind myself to take a deep breath. My breaths was going in and coming out free and clear without any restrictions or hesitations by my body. The usual pain that I had in my lower back and hips that was every day, it was gone. I didn't feel anything.
Mm.
So I was like, God, thank you. Thank you. It was something that at one point the devil thought me had me thinking I would never see until I was on the other side, dead. So that's why I thought I was dead when I woke up. And life has been like that every day since that morning in 2020.
Yeah, Victoria, listening to you is like I don't know if you get paid to be a motivational speaker or inspirational speaker, but I just listening to you in your faith walk does something for me in my faith walk, and I know it does others too. And just replaying, our conversation here on the podcast when you talked about your dreams as a kid, even though you were dealing with the pain, you still had dreams. When you wanted to play basketball, you wanted to be a cheerleader, you still had dreams. When you got to adulthood, you still wanted to be a doctor or a lawyer to help people. Come on, somebody, listen. But now you're doing exactly those things that a doctor or lawyer, you're doing it in a different way. Like, how
Yes.
has life after CRISPR just affected your ability to dream again and to think about, what the future looks like?
It brought back my ability to dream again. I had stopped dreaming. Once
Mm.
all my hopes was crushed um, by the healthcare system, and I feel like the people that was here to help me wasn't going to help me, didn't want to, I stopped dreaming. But now I dream, and I dream big. And I come to realize, and someone said it to me, do you not realize that your yes have saved more lives than you would have saved as a doctor?
I mean, listen, I, I'm glad you said that. Being part of healthcare industry and things like that, like um, you have a great appreciation for doctors, healthcare providers, researchers who come up with these incredible cares. But at the end of the day, it is to really serve patients, and those patients and their stories can help far more people to fight, to dream, to think big and possibly see themselves differently. I mean, you restore your ability to dream. You said you couldn't travel, but now you're traveling all over the
Yes.
world. You spoke at the International Summit on Gene Editing.
Yes, in London. That was my second flight in my life, was a flight around the world.
My goodness. What was that like to be standing there? I mean, and did you really know that like your decision, your yes marked a major milestone in the history of medicine?
I realized it later, but going into it, hearing that I would be the first, I had the mindset that somebody had to do it. Somebody
Mm,
had to take the risk for all the people that are suffering. In order for the change to come about that we had been praying for, somebody had to risk it all. And I said, why not me? Um, because I trusted God would see me through it. And if it worked for me, oh my God, what it would mean for the other people who are suffering. So um, I was blessed to be able to be that. And that invitation to London helped me keep my promise that I made to God. When I asked Him to do this for me, I said, God, if you do it, I'll tell the world about it. So when I got that invitation and it said international summit, I said, okay, God, you did your part. Now you're going to see if I'm going to do mine. So I was nervous, but no matter what, I had to keep that promise to God that I'll let the world know what He did for me, um, so it could help other people who was in that place that I was in the bed, couldn't go just from going from the bed to the couch, couch to the bed, couldn't do much more in life. To spark that hope, to give them the energy to fight just another day.
yes. And, through your courage and your faith, there are now two drugs on the market that are gene editing CRISPR Cas9 technology to modify patients' blood forming stem cells. And, these treated cells begin making new healthy blood cells, and their lives are being transformed all over the world. And what's next for this technology is to help people with cancer patients, heart disease, and muscular dystrophy. These chronic diseases that are affecting millions and millions of people all over the world. And it's been through your faith and courage and fight. Thank God for, Big Mama raising us in the church. Come on, somebody.
Yes.
So tell me, because there's a lot of patients out there who are still experiencing the perception, right? The battle, like showing up. Like, what are three questions that these patients or their family members can ask their doctor or their care team to advocate for themselves, to find a doctor who sees them as a partner and can turn that relationship into a partnership? What can they ask their doctors to seek, better care, or to possibly, be treated with a CRISPR technology?
One, you can ask your doctors what options can he provide for you besides pain medicine. That's that's the number one question. And if he can't provide anything more than pain medicine and a blood transfusion, you need to be somewhere else.
Mm.
And another
Because he may
question,
not know. They may not
right?
know.
Another question is, if I ask you, or if I let you know that a medicine is not working for me, will you listen and change it?
that is a yes. Okay. Sorry. that is it sounds simple, but there's a lot of folks and Victoria, you could probably tell us like that just don't ask those questions. They just listen to their doctor because that person is the expert in charge with giving them the relief. But sometimes we need to really question, are they partners with us in our care?
Yes. And another question, you can ask your doctor if you don't know how to help me, do you know of any other place I can find advanced treatments? Because some hospitals are just not equipped. They don't have the equipment or the technology to perform these type of therapies and treatments. So just to see if they're willing to recommend you somewhere else.
Absolutely, because many of these health centers, maybe in rural areas or that are not in the big city, they are connected to larger academic centers or have a line in to know what's going on in those places, like you did in Nashville, and refer you to those centers. But many times they may not even share the news with you because of their perceptions. Maybe you can't make it that far. Maybe you're not interested in the clinical trial. Maybe, you know, any number of things, but it's very important to arm ourselves with the questions and go in and ensure that they're thinking as a partner with us to make treatment decisions. Victoria, I don't know. I don't want it to end because like you shared so much with us, but like you're so inspiring and empowering. The world needs to hear your message, and I wish you nothing but abundant life as you continue to share your story and to help millions and millions of patients in a way that you maybe didn't think, but you're certainly fulfilling a calling for many people.
Thank you.
Victoria Gray, um, Victoria Gray, sickle cell warrior and faith warrior, who has just inspired me, and I hope you as well. Thank you for being a guest on Genetics for Healthcare.
Thank you for having me.